Emery-Dreifuss Muscular Dystrophy, EDMD, is a rare inherited disorder that weakens the muscles that move the arms, legs, and torso. It also affects the heart and the muscles that hold the shoulders and hips in place. Think of the muscles as ropes that pull your bones. In EDMD, the ropes become frayed and less strong, so they cannot pull as well. EDMD is caused by mutation in specific genes that tell the body how to build proteins needed for muscle and heart cells. The most common genes are EMD, which makes a protein called Emerin, and LMNA, which makes lamina C. The disease can be passed down in 3 ways. X-linked mostly affects boys, autosomal dominant or autosomal recessive. For example, a mother who carries an EMD mutation on one of her 2 X chromosomes can give the mutated gene to her son, who will then show symptoms. Typical signs appear in childhood or early teens and include joint contractures, elbows, neck, and heels become stiff, making it hard to straighten or bend them, like trying to open a door that's stuck. Muscle weakness, especially in the shoulders, upper arms, and calves. A child may have trouble climbing stairs or lifting objects. Heart problems, irregular heartbeat, arrhythmia, or a weakened heart muscle, which can cause fainting or fatigue. These symptoms often start slowly, so families might first notice a child getting clumsier or complaining of sore muscles after play. Doctors diagnose EDMD through a combination of steps: physical exam, checking for stiff joints and muscle strength; blood test, measuring creatine kinase CK, an enzyme that rises when muscles are damaged; genetic testing, looking for mutations in EMD or LMNA genes, the definitive test; heart evaluation, ECG, Holter monitor, or echocardiogram to spot rhythm problems. Treatment focuses on managing symptoms. Physical therapy to keep joints flexible and maintain muscle strength. Orthopedic surgery may be needed to release very tight contractures. Cardiac care such as pacemakers or implantable defibrillators to control arrhythmias. Medications like beta blockers for heart rhythm control. Regular follow-up with a neurologist, cardiologist, and physiotherapist is essential. Because EDMD is genetic, the main way to prevent it is through family planning and early detection. Parents who know they carry a mutation can seek genetic counseling before having children to understand the risk of passing the gene. Consider prenatal testing, chorionic villus sampling or amniocentesis, or pre-implantation genetic diagnosis with IVF to select embryos without the mutation. Screen siblings early if a family member is diagnosed, so that therapy and heart monitoring can start before serious problems develop. Recent advances include gene editing research using CRISPR-Cas9 to correct LMNA mutations in lab-grown muscle cells, showing promise for future cell-based therapies. Targeted drug trials that aim to improve the stability of the nuclear envelope, the cell's shell, where lamin proteins work. Early phase studies have reported modest improvements in muscle function. Improved cardiac devices that are smaller and have longer battery life, making it easier for young patients to live active lives. These developments are still experimental, but they give hope that one day the disease could be treated more directly rather than just managing symptoms.